We'll go to the Union Buildings live there once it starts, but let's just get some pre-analysis on what to expect from President Cyril Ramaphosa. Political analyst Ongama Mtimka joins me now via Skype. Ongama, thank you very much indeed for your time. So the conversation has very much shifted, recently, the national discourse to, what South Africa's relaxed lockdown and whether there would be a different way that the state can still save lives, but still keep the economy running too.
Indeed. Good evening, Griselda, and your viewers. We're in very interesting times in South Africa, where we see the emergence of a political economic situation necessitated by the outbreak of a pandemic. And initially, government had a lot of latitude to take decisions. But over time, the stage on which executive power is exercised, Griselda, has changed dramatically. Government, as we speak, is facing a number of court challenges on how it exercises its power, and those challenges have narrowed down to things like, for example, the legitimacy of the National Coronavirus Command Council, the extent to which decisions are making sense. So the four broad fronts on which government has responded to this, which is prevention, responsiveness to infections, public engagement, as well as relief, all of those are facing major contestations. Government no longer has, the latitude to act in ways that, make them be challenged less. Yeah. So the problem has become more complex since we started on this path.
And Ongama, how much pressure does that put on President Cyril Ramaphosa? You mentioned quite a number of issues that have gone to court. We talk about the cigarette ban. We're yet to hear from the courts what the outcome of that is. The restaurant industry has not been too pleased about not being able to operate or have sit-downs during lockdown level 3. And you also have, a continuing and growing calls from various provinces for a reintroduction of the alcohol ban due to the pressure that it has put on the health system in the country. How much pressure is President Cyril Ramaphosa under tonight?
So, in psychoanalytical terms, the president is very sensitive to how he is perceived and how his government is perceived. He is naturally, or the most comfortable style of leadership for him is consensus building. And instances where there's a legitimacy crisis and decisions of government are challenged everywhere, I think it puts him in a space where the burden to be seen in positive light actually becomes a lot more for him. So today, for example, as hinted by Minister in the Presidency, Jackson Mthembu, we do expect to hear what's going to happen with the restaurants, the salons, and other economic sectors that have been saying, you've opened certain activities that bring people together, why not us? So the president is going to want to present a message here that government is attempting to become a lot more consistent, a lot more rational, and while not losing the battle. So if you look at the tone of his message to South Africans this week, he's emphasizing that while there are areas like the Western Cape and the Eastern Cape where the levels of infection are way higher, he is in touch with both of those governments to ensure that responsiveness continues to match what is required, even though he admits that some of even the plans that are there may need to be augmented. But in general, Griselda, to come back to your question, I think the president will be at pains to try and reclaim a sense of legitimacy for state action, while also attempting to reassure South Africans, especially those who have been critical of the relaxation of some of the regulations, that government, one way or another, is still attempting to bring the situation under control.
While, Ongama, there's been criticism of a relaxation of the lockdown too soon, others would say, but South Africa is clearly starting to see the number of infections in the country at numbers that we have not seen previously. So what is the catch then between what you say is the president wanting to be seen to be pleasing everyone and also having to do the right thing in terms of making sure that the economy, which has taken such a significant knock, is somewhat able to operate again at whatever pace, and also keep South Africans, assured that despite a huge increase in the number of infections, the government has all of this under control?
So at the back of people's mind in asking that, in debating with that question, Griselda, has been the extent to which lockdown can continue to be used in order to prevent greater infections. Now, initially, there was a very comfortable dichotomy created between livelihoods and lives. I believe that about probably 6 weeks into lockdown and the outbreak of the pandemic in South Africa, that became a strongly false dichotomy. In the sense that, indeed, while lockdown had been successful and a case could be made that at certain time its benefits were far greater than whatever losses we were making at an economic level. Beyond week 6, as I roughly estimate, there's no longer such a dichotomy, such that lockdown as a government strategy is highly problematic should it come. I suppose that in certain instances, so people would be asking, for example, what's the likelihood that places like the Western Cape and the Eastern Cape can get to be under lockdown? I doubt very much that government wants to buy into that strategy, because they've already said that how they are going to respond is more on individualized, custom-made level per area that is highly infected, rather than attempting to resort to lockdown, because its benefits can no longer be assumed to be greater than the costs that it actually creates itself socioeconomically.
Do you think that the president would also tonight want to somewhat vindicate some of the decisions that the Coronavirus Command Council has taken because of some of these legal challenges that we're already seeing before court, and many criticizing them as being totally irrational? I mean, for example, when we saw arguments inside court relating to the continuing ban on the sale of cigarettes, majority of the argument was that there is no way that South Africa, or even the WHO in its previous assertion, had indicated that those who smoke cigarettes are in any way more vulnerable to the coronavirus than anyone else.
Indeed, so the debates have centered around inherent medical, or let me say endogenous medical factors, as well as how those relate to the economy. My sense is that where government can prove without doubt or with minimal doubt that there's a direct medical issue, or in fact the harm principle would be violated if certain activities are being allowed, such as, for example, alcohol, then government must be very firm around those issues. So, for example, if you look at the debates that have come from the Eastern Cape around the behavior and the consequences of reopening the sale of liquor, those need to be taken into account. But government shouldn't act arbitrarily. And in fact, the space within which they could do that has become a lot more narrow. So I doubt very much that they are going to revert to decisions or prohibiting things which can be challenged. So I think we have arrived at a stage in exercise of executive authority in the COVID-19 where legality is going to be a strong driver as government takes game theoretic decisions, anticipating what others may do as a result of the decisions they may take.
And of course, Ongama, taking into account that South Africa has not yet reached its peak, that is still expected. We've just about entered the winter period, and the expectation generally is that we've not seen the worst of the coronavirus in South Africa yet. How does government then balance that versus some of the decisions which we're expecting the president to make tonight, which will speak to quite a number, possibly, of other industries also opening in the country?
So the question there, Griselda, is that what tools are available to the state to cope with an outbreak that reaches peak levels? On one level, as far as prevention is concerned, we know that they still have the option of a lockdown, but it's highly problematic. On the second level, you have the responsiveness of the healthcare system. Government feels that they've been able to successfully delay outbreaks such that they are a lot more ready now. But what's become clear is that the capacity of the healthcare system, notwithstanding the levels of readiness that are being claimed, is highly compromised. And in fact, whether you are looking at the private medical practice sector or the state sector, it's highly compromised. So there's a degree to which whatever can be done in the short term, so far we haven't done enough to be able to contain a particular part of the negative consequences that we're going to see.
All right, we're expecting the president to take to the podium any moment now at the Union buildings. But Ongama, thank you very much indeed for your pre-analysis of what is likely to come out of the president's address to the nation this evening. Let's take a short break now, and hopefully when we come back, the president will be close to taking the podium to addressing the nation.